honestly can't imagine life in radiology without the RSNA. I've been affiliated with RSNA since I was a very junior faculty at the University of Utah and have been a member attending the annual meetings for 30 plus years. I find it, the thing that I like most about the RSNA is it's what I would call, for lack of a better term, its power of convocation. It draws people from all over the world. So in many respects, the RSNA family is a truly international family. I meet and see people here that I've met all over the globe. And when we meet here, we meet as family and as friends and as colleagues. And so it's like, in addition to being a premier educational meeting, it's like one big family reunion. Well, certainly radiology has been forwarded by our young investigators, many of whom received their start in radiology investigation through Research and Education Foundation grants, which I think we return something like $30 for every dollar awarded. That's a pretty good return on investment, or ROI. And when these young investigators blossom into some of the premier scientific clinical investigators in our specialty, they bring back and give back to all of us who helped get them their start, something that then we can use in our day-to-day practice. So it's not just the education, the research, and the sharing of new technologies and findings, but it's basically the opportunity to grow careers. That's one of the things that I think is very important about the RSNA. I think one of the other things about the RSNA is that in addition to having the opportunity to meet with people from all over the world is the growing emphasis on patients first. And that emphasis on thinking about our patients, what we're doing to our patients, what we're doing for our patients, is a welcome shift in emphasis. You know, we're learning to do things and emphasizing things like image gently, image appropriately, and image wisely. Well, I started off being a member of a number of different RSNA committees, and eventually, because of my interest in both research and education, I became the chair of the R&E Foundation, the Research and Education Foundation, and while I was chair, we launched and completed our first really large fundraising campaign where we raised over $15 million for research and education. And the chairs of that foundation since then have taken that ball, run with it, and now as we approach our 100th year, our centennial year for the RSNA, are expanding on that tremendously because we want to give young investigators, young clinician scholars, young teachers and educators the opportunity to get the start that many of us had thanks to the RSNA. Well, I'm old enough to have seen not just change, but complete change. Most of the techniques and procedures that I learned when I was a resident and in training at Stanford, we don't even do anymore. Or if we do them, things like angiography, we do them often in non-invasive ways using CT angiography, MR angiography, and so on. And so if you think you've learned it all as a resident and fellow, you haven't. If you think you know it all as a practicing radiologist who's been out for umpty-ump years, we don't. We're all students. That's one of the things I love about this meeting is I always learn things that will make me a better radiologist that I can take back that will improve not only my practice, but the practice of colleagues as we share that information. I think, first of all, I'd tell young residents how amazingly fortunate they are to be in the specialty of radiology. You have to be a really top student to become a radiology resident. And once you became a radiology resident, there is this entire new world of imaging in all body parts and all modalities. It's like walking into a large supermarket and being overwhelmed with a bunch of delicious choices. And I'd say to them, keep studying, enjoy the ride, and know that you belong to one of the greatest professions on the planet. Well, we don't do many of the brain imaging studies that we used to do. We used to do this horrifically medieval torture procedure called pneumoencephalography, where you would stick a needle in somebody's spine and inject air into the subarachnoid space of the spine, and it really was a painful procedure. The first time I ever saw one, I'm kind of embarrassed to say, I passed out. I passed out. I thought it was so awful, because the only kinds of contrast we had, you could either put contrast in arteries or you could put contrast in the subarachnoid space, and that is really primitive. That's just simply not done anymore. The advent of CT scanning and the advent of MR has completely revolutionized neuroradiology, as it really has with virtually all of the other subspecialties.